Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. I can't wait to chat with you. Do you remember the first time that you had the discussion or the class in school to learn about the reproductive system? My first time that I remember was in 5th grade, which looking back now, I feel like was a little bit late because several of the girls in my class had already started their periods by then, now looking back now. But I remember it being horribly awkward. The teachers didn't want to be there. The students didn't want to be there. It was just like, oh my gosh, make it go away. And they just popped in this video. And I remember, I will never forget this. I remember it was a video of this mom talking to her 2 daughters. It was in the morning and she was making pancakes and she was like so casually talking about this. But then she pours the pancake batter into the pan in the shape of ovaries, fallopian tubes, and a uterus. And it was mortifying. I couldn't eat pancakes for so many months after that because I was so worried my mom was going to start talking to me about this when she was making them. Like, no, I don't want pancakes today. Anything else. And then the next time that I remember talking about it, I don't know if we did this between then, but the next time was when I was in high school. It was in health class. And that was even worse because my teacher was this really old man who was super awkward and his face was like fire engine red the entire time that we were watching this video on reproduction and how to get pregnant and how to deliver a baby. And it was so awful. But the message throughout it all was the same. How to not get pregnant. Don't get pregnant. Don't do it. Avoid this. Don't get pregnant. Just don't do it. And so we spend all this time learning how to not get pregnant. But we don't actually learn enough about what our bodies are actually supposed to do or how to get pregnant when it's actually time. And if you're like me and you struggle to get pregnant, it's kind of a, okay, well, I spent all this time trying not to get pregnant, and now that I want to get pregnant, I can't do it. So that's why we're here today. And I say there's no time like the present to redo that conversation and talk about our reproductive system and how you can enhance it and how you can improve it so you can create the family of your dreams, which is why I'm so glad to have my friend and colleague, Dr. Marc Sklar, here to bust the myths about reproduction and fertility that we've somehow gained throughout all these years, and to give you some real advice on how to get pregnant, especially if you're having trouble conceiving. For more than 15 years, the fertility expert Dr. Marc Sklar has been helping couples struggling to conceive and have healthy babies. In addition to his Doctor of Acupuncture and Oriental Medicine, Dr. Sklar trained at the Harvard Medical School Mind-Body Medical Institute. He's the creator of MarcSklar.com and the reproductivewellness.com, the co-author of Secret to Conception, and a fellow of the American Board of Oriental Reproductive Medicine and medical advisor for Natural Health International. Dr. Sklar lives in San Diego with his wife and 2 sons. And if you're ready to start a family, the fertility expert can help. He can help you get pregnant wherever you are through his online consultations and programs. I'm so excited that you're here. Welcome, Dr. Sklar.
Thanks for having me. I'm excited to be here, and I loved your introduction. It was awesome.
I mean, did you go through that too? It was like a horrible experience.
No, actually, interestingly enough, I never was taught about the birds and the bees in school. It really came from my older brothers. Which probably wasn't the best now, come to think of it. Looking.
So a little less awkward, but probably a little more accurate.
It was, yes. Although, they were 9 and 7 years older than me. So, their intention of what they wanted me to learn and why they wanted me to learn it was probably a little different than the teacher in the classroom. So
that's right.
But regardless, I've heard the story that you just mentioned often, that it's awkward, it's in a classroom, what they're trying to teach you is is maybe a little bit helpful, but a little bit off, and it's always about how not to get pregnant, but not how to manage anything else. So they're really not teaching you things, or they really didn't teach you things. I don't know if they still do that class actually, but they
That's
weren't.
a good question. I don't
Yeah, they're
know.
not really teaching you anything that lets you understand the system in a more accurate and more complete sense. It's more about like scaring you and causing a little bit of concern to hopefully not get you to have sex so you don't have children at a young age.
Exactly. And what I think it does is it disconnects you from your body because then you're like, okay, well, just don't do anything that has to do with that and don't ask about it and don't talk about it and don't do anything. But you never learn that, hey, actually, your reproductive system, the symptoms that you might be having, maybe long periods, heavy periods, no periods, that could be a sign of something that has nothing to do with family building right now, but might affect it when you're ready. And hey, now might be the time to talk about it and really figure it out.
Oh yeah, absolutely. But plus they also make it seem like you could look at, your boyfriend or girlfriend and they'll get pregnant. Like they
Right.
make it seem like it's so easy to get pregnant at that age, and certainly at those young ages you have a much higher chance of getting pregnant. But even then, it's still only like 25 to 30%, right? So, but they make it seem like it's 100%.
100%.
Don't even come that close to them that you can even do anything that would remotely get you into that predicament.
Absolutely. Right, right. And then here you are, however many years later, going, doing everything right. Still not working. What's going on? And you have no idea where to start.
Exactly. No, I mean, I don't think those classes do a big service to on the education side of things.
Absolutely. Absolutely. So, just to kind of catch us all up, what brought you to the work that you do in fertility to help women and couples get pregnant?
Yeah, I always joke that it kind of just happened to me, although I was always interested in health and health care. And I was always that person where I was always very close with a lot of girls growing up. I had a lot of close girlfriends, and they always came to me with their concerns or problems. I was always someone that they bounced ideas off of. But so coming into this field really felt and still does feel very, very natural to me, and very easy. My wife always jokes how I know more about her girlfriends than she does. But I still, it wasn't something that was in my or on my radar when I was trying to make decisions about what I was going to do with my life and what career I was going to go down. So it kind of just happened that I ended up in this area of specialty, in the sense that when I went to graduate school to get my doctor of medical degree, I assisted with a provider for 4 years, and she specialized in women's health and fertility. And I started to learn so much from her and just see the power and impact that it had on patients and families. And really, I connected with it, and it felt very natural and easy to go into that direction, which is why I went down there. But the two turning points really for me were my first two patients, if you will, that I treated. Both were while I was in school in my final year, and one was a woman who suffered with PCOS, and after working with her for 4 months, she became pregnant, regulated her cycles. She now has 4 kids.
Wow.
Her child was someone who I always remember. She named her Faith for obvious reasons on her end. But aside from the pictures on my desk of my 2 boys, she's the only little baby picture I have in my office, on my desk, because it reminds me back to kind of where I started and why I started all of this. And
It really stays with you, doesn't it?
yeah, it really does. And then simultaneously, my oldest brother, who doesn't live near me. I'm originally from Miami, so my whole family's back in Florida. But he and his wife were having some struggles at that time, and I couldn't see them on a regular basis, but I did guide them and coach them a little bit and steer them in the right direction. And they both happened to get pregnant, that patient and my brother at roughly around the same time.
Oh,
And so
cool.
those two things kind of really pushed me down this road. It was a very easy decision at that point, and I really never looked back.
Yeah, I was like, life was just guiding you this way, going, this is where you belong. Come.
I try to listen at those times.
Yeah, right. And those are, as a patient who has gone and struggled with infertility, I know that people like you are who we need in the field because we need somebody who's just meant to be there and loves the work and is so good at the work because we're scared and we don't know what's happening and there's so much on the line, and knowing that you're there with your full heart and soul really makes such a difference from the patient perspective.
Yeah, I think it does. At least that's the feedback that I hear from patients. And I think it's important, we all have our journey, right? And our struggles, and that have led you to either pick up the phone and call me or walk into my office and sit down next to me. And I think it's important that they understand why I do what I do, right? It's not because I think this is, a cool field. I mean, it is. I think it's an interesting specialty, and it always keeps me on my toes. But I have a really strong connection with it, and I have a strong, inspiration behind it to really make the difference in people's lives. I think it's such a powerful thing to
Yeah.
really help somebody have a child and grow their family, extend their genealogy and so forth. So
Yeah.
it's really special, and I don't take it for granted. It's something that I really enjoy, and I really enjoy that time when patients call or email or walk in the office and say I'm pregnant, and I really enjoy when they bring in their babies or something.
Oh.
So yeah, it's really special.
Yes, yes, absolutely. And you become part of the family too, because now
Yeah,
you've helped create this little person that the couples didn't know that they could even have.
exactly,
I
exactly.
love that.
Yeah.
So circling back then to what we'd originally started this on, which was we don't have a lot of good information about our fertility, about our reproductive system. Based on your experience, what would you say are the top three or so most common myths or misconceptions that patients come in having about their fertility or reproduction?
The first one I think we kind of alluded to previously when we were talking about, sex ed in, high school or elementary school or whatever. I think we're made to believe that it's much easier to get pregnant than it is. I think that we see, you know, we're not. I don't think we associate ourselves with animals directly, but we are. And when we see other animals around us having children so easily, right? Oh, they have litters of babies that we think, oh, it should be that. It's probably going to be that easy for us, and we don't really know the exact true numbers and percentages of what that really looks like. So I think there's a big misunderstanding and misconception that it's much easier to get pregnant than we think.
Yes.
So we tend to start a little bit later in life. We think it's only going to take one try, or 1 month or one cycle, however you want to word it. So I think that's a big, misconception for sure.
And how long would you say it actually takes? If could be because you're right. I mean, a lot of my friends I know were saying, "Oh my gosh, I tried for a month or two and it didn't work." And my response is, "Well, yeah, of course it didn't." So what do you tell your patients about how long to expect it to take, assuming everything else is normal?
Yeah, I think it's going to take somewhere between 6 and 12 months,
That's very sobering.
and I use those numbers specifically because if you were that, you know, 18 to 21-year-old that I mentioned earlier that has about a 25 to 30% success rate every cycle, it means you need on average 4 months of trying or four menstrual cycles of trying to get pregnant at that age. And that's the best chance you ever have. And your percentages only go down from there as you age. So, it's hard to know exactly where you fall into those percentages because it's not an exact science to say, oh, as every
Right.
year you age, you lose a percentage. It doesn't work that way. But, but if you just use that as a guideline and then you're looking back and saying, well, I'm 35, right? So at my best, I had a 30% success rate. maybe now I have a 15 or 20% success rate. You just got to add 2 or 3 more months onto that trying phase, right? To give
Yeah.
you enough time and chances. And certainly as you age, you need more time to really see if that's going to work. But on the flip side of that, as you get older, you also don't want to wait too long,
Right.
because before you start to investigate a little bit further, because then you've just wasted more time per se. So there's a fine line there.
Absolutely, absolutely. But I love that you shared that. And those of you that are listening, I hope that number really sticks with you, because even though it isn't an exact number and it's different for everyone, and we all know somebody who got pregnant on their first try, and it happens, but it really helps to give you a realistic expectation. And I think then it reduces a little bit of the pressure that you have to get the positive pregnancy test immediately, that if it takes a few months, that's okay. That's kind of what's supposed to happen
Yeah.
to a degree.
Yeah, I agree with you in that note. I'd say the only caveat to that is if you already know that you have a hormonal imbalance or a
Yes.
menstrual related disorder, then I might shorten that time frame or be more proactive in trying to address those things while you're starting to try. I might approach that a little differently.
Yes, exactly. Exactly. That's a whole other group of people, I think, that need a little bit different guidance on how to manage it, which would be really interesting to talk about afterwards. So the first one you'd say is the myth is that it's easier to get pregnant than it actually is. What
Yeah.
would you say are a couple other common misconceptions people have?
Yeah, I think the fact that everyone thinks that responsibility falls on the woman in the relationship,
Yes.
I think is a huge misconception and misunderstanding. There's really very little evidence to show that, if none at all. Um, you know,
Yeah.
for the most part, we have very clear evidence that it's about 40%, 35 to 40% of the time, it's a female-related issue. 35 to 40% of the time, it's a male-related issue, and that other percentage is either mixed or unexplained. And so, it's very, very clear that the man plays a huge role in this. And even though they don't carry the child to full term, and they're not bearing the responsibility during the actual pregnancy, doesn't mean that genetically they're not responsible. And so I think that needs to be, wholeheartedly addressed and looked at
Yes.
as you're doing your evaluation, as everyone's kind of taking responsibility for what is their issue. So yeah, absolutely. I think that the man needs to be evaluated, needs to take their responsibility in the process and kind of step up to the plate, if you will.
Absolutely. And I would even add here too that for those of you that are listening, if you're a woman and you know you have some kind of health concern that could affect your ability to get pregnant, I would still have your male partner go in and get tested with you anyway.
Absolutely.
Let's figure out the whole picture before you know what you're dealing with.
Yeah, absolutely.
Yeah, awesome. That's great. So it is the huge misconception is it's easier to get pregnant than it actually is. The responsibility doesn't actually fall just on the woman, that the man plays a huge role as well in your ability to conceive a child. Is there anything else that comes to mind as a common misconception?
Yeah, I think the common misconception is that your OBGYN has all the answers.
Oh my gosh, thank you for saying that. Yes, yes, yes.
I think we go in and and by no means am I trying to be disrespectful to your
Sure.
gynecologist or OBGYN, but I think there's a real truly misconception and understanding that we believe that the person with the white coat on when you walk into that office is going to not only have all the answers, but it's going to guide you in the best direction for you.
Yes.
And I think that's a big concern for me, because first and foremost, not only do they not have all the answers, they often don't have the time to address and deal with your situation appropriately. And they're more often than not going to send you to the IVF clinic. I mean,
Yeah.
that's really their answer to, oh, I'm having trouble. I've been trying for a little bit of time. I'm not getting pregnant. So they're like, well, let's start with some blood work. Well, they do like 2 or 3 labs, which is really very, very incomplete. They're missing, 80% of what they should be testing for. So that's another issue. But two,
Absolutely.
they don't have the answers or the time to deal with you. So the next thing that they're going to do is say, well, let's just send you to the fertility clinic because that's all they know in terms of an answer. And all the fertility clinic's going to say is, well, you should do IVF. And there's a time and a place for IVF. But if I had to add a fourth misconception understanding is that, it would be that IVF is not the answer for everybody and it's not 100% successful.
Right,
So,
which is absolutely true.
yeah,
And I love that you said this here because you had so many important points that I want to make sure our listeners really get, which is number one, when you're doing this, if you're having trouble getting pregnant, the standard blood work that your OBGYN is going to recommend is not complete. So you do want to make sure that you get complete blood work for you and your male partner, because we just talked about that. And then the second thing is you want to make sure you understand what you're dealing with before you figure out what options you have, because you're absolutely right. I mean, I conceived via IVF because I had to. That there was no other option for me, but that is not the case for everyone. And there is this assumption, you're absolutely right, that if I can't conceive on my own, I have to do IVF. And there's so many other things that you can do before you get to that. If that's something that is an option for you, you just need to know what you're dealing with first.
yeah, absolutely. Absolutely.
I love this.
I think IVF has a place in the process,
Yes.
but I think all too many couples are pushed in that direction too quickly, unnecessarily, and probably if they were given the right opportunity and guidance, never even needed it.
Yeah, that's right. So, I mean, let's talk about this because this is so fascinating to me that there's so much out there and this is what you specialize in. So what are some of these other options that men and women and couples have to enhance their fertility that's outside of this IVF option?
Yeah, I think it's too easy in our day and age to look at the medical options around us and and get the proper guidance. I think what ends up happening is that we're looking, the way our culture is designed right now is we're looking for that one magic pill, that one magic answer or solution that's going to, that somebody, not only that, but that somebody else can provide to you
Yes.
that can solve the problem. And I think that changes the responsibility and pushes that responsibility onto somebody else and not onto you all as patients. So I think that's the first issue that I have with it, is that I think we all need to take responsibility for our own lives and our own health. And we need to be really proactive in making the necessary changes to become healthier. Reproductive function and health is a reflection of overall health. So if your reproductive system is not working properly, it's usually a bigger sign and issue that something else is not functioning properly that really needs to be addressed. And so by just looking for that magic pill, you're not really addressing the true issue at hand.
Yeah. So basically what you're experiencing with your reproductive health is not the problem. It's actually a symptom of a bigger problem that needs to be addressed.
Well, it could be the problem in and of itself, but there's, fertility is not the problem. It's something else. Now that could be hormonal, which is still part of your reproductive system, or it could be elsewhere. But infertility, if you will, which I don't really like to use that word, but that's a symptom. That's not the problem that needs to be treated, in my opinion. Yeah.
So the problem could be hormonal, the problem could be structural, it could be, but you're saying there's something else that needs to be addressed.
Yes, absolutely.
Yeah. Yeah, totally makes sense. And I love what you're saying about taking that responsibility, because you're so right. This is exactly the way that our system and our community is just going, is we're looking to other people to give us the solution when it's our body that we know best that needs to be addressed and needs to be taken care of. And who's best to do that other than ourselves, because we're the experts on our own bodies.
Yeah, and we have to listen to our bodies, and even just because I might be the person who creates a plan for you and creates guidance for you, but, I don't know your body better than you do. So, oftentimes when I have those conversations with patients, I'm listening to their feedback as well and saying, well, based on what you told me, let's tweak this, right? Let's adjust it to suit your needs, because that's not, just because I wrote it out this way and I think I know you doesn't mean that I know you better than you. And so you've got to take that responsibility, trust your intuition. and start to make the necessary changes in your life, whether that's lifestyle, diet, stress, work, home environment. We can have a long list here, right, of things that need
Right.
to be addressed and treated, if you will. But you're the one who has to do it. And those are the ones
Yes.
people always ask me. So, how successful are you? I was like, well, I'm very successful for the patients who follow through with what I'm asking them to do.
Totally. Yes. Same here. I can really relate. Yes.
But if you're not going to do anything and you're just going to listen to the list, like I have a patient, and this was from years ago, but I remember the conversation very, very well. I wrote out the plan. She had PCOS, and when she saw the plan, she's like, I can't do this. I'm like, well, you can if you want to make this happen. And I know it's difficult, and I'm not pretending to think that it's easy, but you can do it. And it's different than what you're currently doing, but you absolutely can do it if you want to make this happen. And she was like, I'm not going to do this. I can't do this.
Yeah.
But she made that decision for herself. That was her choice.
Right.
Yeah.
Right. And that's okay.
And that's
If
okay.
that's what you decide, then that's okay, but that's got to be a choice that you make.
Yeah.
Absolutely. Absolutely. So then in terms of kind of what are these options or what are the steps that men and women or couples can take if they're not quite ready to go to IVF, or maybe they don't think they want it? What are some of the things that they can try? I know you mentioned diet, stress, sleep, a lot of lifestyle changes.
Yeah.
What else do you often recommend to your patients?
So I always start by telling patients you need to change what you're doing on a regular basis. There's nothing more important that can have as much of an impact on your overall health and life as the things that you do every day. How well you're sleeping, enough good quality and length of sleep, how well you're eating and feeding your body. Probably there's nothing more important than the food and liquid that you put into your body. How well you're exercising. Doesn't have to be anything crazy, but you just have to create and develop regular, healthy lifestyle habits that we all know of. Like, it seems silly in many ways to mention these, but I promise you, 90% of you don't do it. Right?
Yeah.
You're just
We know we should do it, but then we're not doing it.
right, because it takes too much effort and it's hard to change habits.
Yeah.
But for sure, those things will have huge impacts for you. Now, are those the only things that we should or can do? No, I don't believe so. But I think that's the place where, in my mind, that things end, because they're not only going to change things, help to change the environment long term, they're going to help to sustain the changes that we make in other ways. So that way you don't always have to rely on somebody else. And that's one of the things I try to instill in people is you have the power within you if you want it. And these are the tools, your lifestyle tools are the ways that you can manage your overall health forever. Does it mean you need to be 100% of a saint all the time? No. But you can have some flexibility as long as you know where you can have those flexibilities and how you can manage those. And that takes a little bit of time and practice to figure out for yourself as an individual.
Yeah.
Yeah.
There's actually a study that I just read, I think yesterday, that said exactly this, that when they looked at outcomes for couples being able to conceive, what mattered way, way more than anything else were the daily habits that they changed, and not some huge change that they made either to their medical protocol or to their health overall. The medications, like none of that made nearly as much of a difference as seeing and making these day-to-day changes that seem really tiny but have a really powerful effect on your health overall.
Absolutely. And if you just say, okay, you could do it by week or by month. This month, I'm going to work on this one thing. And I'm
There you
going to
go.
make sure I've got this in. And then next month, I add to it. Or this week or these 2 weeks, whatever makes sense for you. But you also can't let yourself off the hook. You need somebody else to hold you accountable.
Yeah.
Those are the things that, I do for patients and, as well as other things. But it's about having someone to hold you accountable. That could be your spouse. That could be a good friend. That could be whoever, that you're teaming up with. But you need to have that accountability, or else it's very easy to fall off the wagon, because your brain is going to tell you, no, you're fine.
It's okay.
It's okay. You can do it tomorrow.
Right.
So having that willpower and determination is huge. And those day-to-day things are, just like you mentioned, I mean, are huge. Now, does it mean that we shouldn't be trying to change things in other ways? No. I mean, that's where a lot of supplement plans, programs that I write out for patients come in. That's where a lot of acupuncture recommendations come in. There's other therapies and things that we can be incorporating that absolutely can have a huge impact. And for me, those should hopefully only be short-term, right? These are therapeutic things that we do to get you to a certain place, and then all the other lifestyle things that you're doing maintain that and keep you where you are.
I love that. And that makes it so much more achievable. It doesn't seem like this huge overhaul that needs to be done and needs to be done immediately, and seems so difficult to do that. Well, then I'm just not going to try, because that seems really hard.
Right.
Right.
Yeah.
But so I'm hearing you talk and you're saying, okay, well, pick one and, really make it into a habit. And I'm thinking, I know we have a lot of listeners here who are like, I'm so sick of not getting pregnant. I'm so sick of trying and trying and trying and nothing's working. I just want to throw everything at it all at once and see what happens. What do you say to patients like that?
It's my least favorite thing to do. Well, you know why? Because I get patients who come in or start talking to me, and they send me their list of things that they're doing or taking, and it's literally a kitchen sink. I mean, It is bags and bags of supplements. And I'm telling you, as much as I'm a huge supplement fan for my patients, and I don't shy away from it, and I can't tell patients that I don't recommend a lot, right? I do. But there's a purpose and a plan and a reason behind it, versus saying, oh, I read that this is good and I read that that's good, and someone said take royal jelly, and then the next person said take Vitex, and then I read somewhere that I should take maca. So I'm taking all three of them, and I'm going to do this, and I'm going to add that in, and there's just like, there's no one overseeing it. It's just, you're just throwing everything at it, and I understand the emotional urge and desire to do that. I just don't think it usually works out in your favor.
Yeah. And I can add, as a patient who's been through this, I totally understand that desperation and that frustration of why isn't this working, and wanting to do as much as you can. And you should do as much as you can, but it's got to be targeted and it's got to make sense, and there has to be a purpose for it. Because think of how much better it'll feel when you do, say, instead of 50 things, you do 5 things, but those 5 things are actually making a difference. And that's what you want to experience. Think of how much better that's going to feel. And that's why it's so important to get support from somebody who's an expert at this, who's going to be able to trim down everything you're doing down to like the most important 1, 2, 5, whatever it is, things that you need to do to help yourself get pregnant, because that's the ultimate goal here.
Absolutely. That's exactly the ultimate goal. And there has to be an organized plan and purpose behind how we approach this. That's just what I've seen to be successful over the years. I do get a lot of questions about it, like, why do I need such a specific plan? Well, you maybe you don't, but I've just seen that that's what works, for the people that I work with.
Which makes sense, because we've experienced it in all other parts of our health too, is if you go by the book all the time, that doesn't necessarily mean you're going to feel the effects of it. Like, for example, I'm extremely sensitive to medication. I've told this story on the podcast before. And anytime I'm prescribed anything, even if it's antibiotics at the regular adult dose, I get overdosed every time. And so I need somebody who's going to know me and listen to me, which goes back to you being the expert on your body, right? Listen to me when I say I can't take adult doses of anything, and then titrate it and really make it very specific to my particular health, because the person right next to me, even if they have the same problem as I do, our bodies are different.
Absolutely. And I listen to patients all the time. When patients tell me that specific thing, like I'm very sensitive to medication, I take that to think as well that they're sensitive to supplements. And so, okay, hey, we got to start slower. I'm going to cut you in half or in a quarter. I'm going to start you on a couple of things and slowly integrate as you're feeling okay managing that. And usually, if I listen to that feedback, and I'm able to manage that, usually it's not a problem.
Right,
Yeah.
right. Which those of you who are listening, I hope you heard what just happened here is that what Dr. Sklar is saying, it starts with you being able to tell him or whoever you're working with what your body's telling you and what those signals are, what your patterns are, and then they can adjust and recommend accordingly. But it's got to start with you sharing that first.
Absolutely. Yeah.
I love it. I love it. So you have something super exciting going on right now, though. You have a program that's just about to open. Is that right?
Yeah, it's actually open for registration right now, but
Fabulous.
in terms of like starting the program, it starts next week on the 18th. It's what I call my Fertility School, and it's my my baby, if you will. It's a 6-week online program to guide you step by step to understanding more about your body, your reproductive health, and your hormones, and then gives you the tools and techniques and strategy for implementing a lot of what we've talked about today, and how I work with patients into your daily life and routine to start to make those the necessary changes to your fertility and improve. So each week we cover a different topic, which goes into which starts with the foundation, understanding your body overall, and then we have a week just purely devoted towards nutrition and diet. We have a week devoted towards the mind-body connection, which is a huge piece of the process, in my opinion. A whole week on supplementation, home therapy techniques that you can be doing at home that improve your chances as well. Tons of awesome bonuses. I have a whole week committed to just supporting patients through their IUI and IVF because so many people are going through that, trying to make that more successful and effective. Wow. Yeah, so
I love it. And so just to confirm, this is an online program, so you can be anywhere in the world and you can join my fertility school.
Absolutely. It's an online program. You can do it from anywhere in the world. I interact with all the members regularly through the private Facebook group and some live Q&As. And if you even wanted to look at the program and then get some special feedback on how to customize the program to your specific needs, then you could do there's different tiers of the membership program, and you can decide which one fits you, but you can work with either me or my team members, and we'll talk with you for an hour about your specific case and needs, and then customize that, or work with you to customize the My Fertility School to your case specifically. But the program in and of itself is designed to help you kind of create your own plan, if you will, based on your understanding of your body and your needs.
I love that. And I got a sneak peek of it on the inside. And what I loved especially about this program is that it does separate it out based on very common concerns or diagnoses or issues that women and men have. I saw there's a separate section for endometriosis versus PCOS. And that's something that I know as a patient, I would have wanted to know about. And so for those of you that are listening, if you're wondering about it, he does do a great job of separating it out because depending on what you're going through, you need some different support. And that's already built into the program, which is amazing. So if you want to know more about My Fertility School, you can head over to parijatdeshpande.com/myfertilityschool. That's parijatdeshpande.com/myfertilityschool, and you can learn all about it. I think it's an amazing program. I wish I'd heard about it when I was going through my fertility treatment as well.
Yeah, I'm fond of it. The feedback's been awesome, so I'm really excited about it.
Yeah. And really, just to hit home, it's all about your body. And it's about you being informed about your body. And the sooner you're informed about what your body's telling you, what your body needs, the sooner you're going to be able to help yourself get pregnant. And that is the essence of this program. And it is so beautifully designed. I'm super excited about it and super excited for you to get access to it. So head over to parijatdeshpande.com/myfertilityschool and you can learn more about that. Dr. Sklar, what are your final words of hope for couples who are trying to conceive?
I think my final words of hope are really believe in yourself, believe in your abilities. And as I like to say to to women is having children, being able to bear children, carry a full-term pregnancy, and deliver a child. That's a gift. That's a superpower. Believe in your superpower to have children and your ability to be fertile. And I think that breaks a lot of barriers. You're going to hear a lot of negative when you start talking to people, reading online, chances, percentages. I'm telling you, I've seen all of those percentages get destroyed. I've seen all sorts of really special stories happen even after they've been told endlessly that it can't, or people have tried 6, 7 IVF cycles unsuccessfully. So I know the power of what your body can do, and I want you to believe in that same power to become pregnant, be fertile, and carry a child.
Oh my gosh, I have chills. That was amazing. I have chills. It's incredible. Thank you so much for sharing that. And thank you so much for the work that you do. The community needs you and needs your work. And we're just so grateful. Thank you so much.
Oh, thanks for having me. I appreciate it.
That was amazing. What I love about having guests like Dr. Sklar on is the hope. There's so much hope out there. And I know it's hard to remember that when you're in the thick of it. I remember it. I remember it so clearly, where it just feels like month after month, nothing is working and your body is failing and you're going, what is wrong with me? But there's so much hope out there. And the amazing thing is that hope starts right with you. The more you pay attention to your body, the more you listen and understand what it's trying to tell you and the patterns that you notice, the signals it's giving you, it's going to guide you to the ultimate goal that you're looking for. I know you want to have a baby. I know you're trying so hard, and you can have that. And Dr. Sklar's program is a great place to start if you are interested in it. But really, it starts with you. Check in with you. Pay attention to your body and let it guide you, because it will guide you to exactly what you need. Thank you so much for joining me here today. If you are trying to get pregnant and you're struggling with it, please check out Dr. Sklar's My Fertility School, and you can do that at parijatdeshpande.com/myfertilityschool. As a patient who has been through this, gone through all the fertility treatment, this is something I wish I'd had. I'll be really honest with you. I wish I'd had it. It's comprehensive. It has a ton of information, and it really starts with the most important aspect, which is you and your body. It's incredible. So check it out at parijatdeshpande.com/myfertilityschool. And also, I would love to stay in touch with you. So follow me on Twitter, Instagram, and Facebook at parijatdesh. That's PARIJATDESH. During a time that is so scary, that's so frustrating, that's so overwhelming, when you just want to have a baby and you can't seem to get pregnant, it can feel really dark. But the answers are in you, and the hope is in you. And the sooner you connect to your body and listen, the sooner that dream can become a reality. Take it one day, one step at a time. You can do this.